Hi, Dr. Alina Kulchitsky, Boutique Bodyworks, Lifestyle Medicine, Fitness, Nutrition, and Wellness. Today I'm going to demonstrate and talk about the forward lunge stretch, which is commonly done, but also commonly done poorly. And that means you're not getting as much as you could out of it, also perhaps putting yourself at risk for hurting yourself, injury. So let's talk about setup. We want to have our feet staggered, 1 foot forward, 1 foot back. Keep the feet parallel so we don't have their heels turning inward, but rather in a straight line. On that back leg, make sure that heel is able to get down flat. So maybe you need to pull it in a little bit. If this is available to you, great, but keep that heel down. Knee is straight so that we get stretched through the front of the thigh like we're intending to with this one, but also heel flat straight so that we get the calf lower leg stretched. Now be careful with the pelvis. We don't want it to dip down. So, we're not even between our legs anywhere in the body. So sometimes we have more mobility on one side and it can be easy to let that hip kind of like down slip on that one side and up slip on the opposite, or even to rotate depending where you're less mobile. Be careful with that. So let's keep those hip bones level this way, and also from front to back, not letting it go on an angle or rotate. So keep it square to the front, okay? And then tuck your tail, get it long towards the floor so you truly get a full stretch through here. And then carefully you're not rounding forward with your back. So we want that chest up so that we're truly getting a full stretch through the front of your hip flexor here. Okay, so those are the best pointers to think about for the best way to get more out of this stretch. And then you can also play with tensioning off, tensioning on. Back off and gently flow forward into the stretch. It's not a bouncing, so don't bounce so we avoid micro tearing, but rather inhale back off, slowly and gently. Exhale, go back forward, tensioning and stretching through those muscles as you exhale, and very gently exploring where your limits are with that movement and pose, and keeping it dynamic and flowing, but at that nice, slow, gentle pace so that your nervous system isn't sensing danger, so you're not micro tearing tissue, especially if there's already tissue issues. And then possibly getting, if there is scar tissue and so on, getting it to move, getting your body to get blood flow in there, and maybe perhaps reabsorb things and get things flowing and moving again. Okay, that's all for now. Make sure you do both sides. Feel free to use this as a movement snack. So even though it is a stretch, it's better to stretch dynamically. Statistics and research show that when we move, dynamic stretching is when we actually get long permanent changes in tissue length, and static, where you hold something for a period of time, doesn't achieve anything. It feels good, and there's nothing wrong with doing that when especially it does feel good at the time, but it doesn't change the length of tissue. So if that's your goal, think of choosing perhaps the dynamic approach instead. So every 30 minutes to 1 hour that you're sitting or standing at work or what have you, you could use this exercise as your movement snack. Do it a few times on each side and then go back to whatever you were doing. Check out my YouTube channel for more videos like this and on nutrition as well, and the other pillars of health with lifestyle medicine. Also check out my webpage, boutiquebodyworks.com, where you can access and subscribe to my Bodyworks toolbox, where you have self-help tools, all of my video explaining things to help you live your optimal, most functional life. Thank you and bye for now.